Selecting the right health insurance plan can seem challenging, but making your selection shouldn't send you to the doctor with stress. So how do you do it? I'm glad you asked. It comes down to two main things. One, how much do you have saved for emergencies? And two, how often do you use medical services?
All right, so let's put up our table. First, you need to think about how much you have saved to cover medical expenses. Remember, this includes emergency funds and money in an HSA. Down here, let's say that you cannot cover your deductible. Now, maybe you don't have anything saved or just a little bit. Now let's say that you can cover your deductible from savings. Up here, you can cover your out-of-pocket max from savings. Take a second and think about your savings and which row you would pick. Now, I want you to think about how much you use medical services. Don't worry, I'm not going to ask you to count up every dollar you spent on healthcare. Do you have a low likelihood of high medical bills? You're healthy and likely to get an annual physical and maybe a minor cold or flu once or twice during the year. Nothing major or recurring. You'll probably hit your deductible. This is the middle ground. If you hit or nearly hit your deductible last year and/or have major medical expenses planned for this year, you may fall into this category. Sometimes folks with chronic conditions are here. You'll probably hit your out-of-pocket max. This is for heavy users of healthcare services. Folks in this category are often managing chronic conditions. Okay, so we've put a lot up here. Deep breath in. Deep breath out. Now, we'll walk through selecting the right type of plan. As you can see, we have green and blue here. What do these mean? If you don't have enough saved to cover your deductible, choosing the non-high deductible plan often makes sense. You want the insurance company to step in and start covering your medical expenses sooner rather than later, since you don't have much saved. Now let's assume that you're a heavy user of healthcare services and you'll likely hit or exceed your out-of-pocket max. If that's the case, selecting a non-high deductible plan can make a lot of sense. As the name implies, these plans have relatively lower deductibles and relatively lower out-of-pocket maxes. The insurance company will begin covering portions of your medical expenses relatively sooner at a lower dollar amount than with a high deductible plan. Now onto those green boxes. If you are a low to medium user of healthcare services and have enough saved to cover at least your deductible, a high deductible plan may be a smart choice. Why? Since you have ample savings and don't use healthcare services a lot, you don't need the insurance company to step in and start covering your medical expenses as soon as folks without any savings. Because of this, the health insurance premiums you pay with each paycheck will be relatively lower with a high deductible plan than with a non-high deductible plan. That's right, generally, high deductible equals lower premiums, and lower deductible equals higher premiums.
So, there you go. Selecting the right health insurance plan for you and your family isn't as complicated as it seems. While healthcare plans will vary from employer to employer and will change a bit each year, the process we walk through today will help you identify the right plan for you.